Diagnosis here in the Pain Center at Stanford is a little bit different than out in the community. We're a multidisciplinary center, so we like to take into account information from all different aspects of the patient's life. From a clinical standpoint, we look at the patient, their clinical symptoms, their history, but we also want to know more about the patient's psychological history and the other factors they bring into their pain syndrome.
We know that pain is not just one area that it affects, it affects all aspects of life. So pain psychology will do an hour to an hour and a half evaluation with new patients, and so we'll get a full sense of who the person is.
We have conferences with the psychologist, the physician, the physical therapist, nursing staff, all present, so that the plan can be a very cohesive plan and we don't miss any aspects of care.
We do have a lot of different modalities that we can do with patients, and a lot of times it gets very confusing. So we use the nursing staff to help coordinate between the physicians, the physical therapists, and the pain psychologists.
The big thing with physical therapy is helping the patient understand where they're at now in terms of their function and giving them realistic goals and how to develop a plan in a stepwise manner to achieve those goals.
A lot of our understanding of pain is that most pain, if not all pain, has a psychological component. Anybody that I see in clinic, I ask them if stress makes their pain worse, and most of the time I hear that it does. So we help people actually bring down the activation of the nervous system through things like diaphragmatic breathing and muscle relaxation. We also use what we call biofeedback. So we actually will hook people up to a computer and actually show them what their body's physiological responses to stress look like, and we help them train those to bring them down.
A physician has a lot of work to do, and having these specialties like psychology and physical therapy where there's a movement perspective brought in can be very helpful for their overall improvements.
I wouldn't be able to do my job nearly as effectively if I didn't have such a talented group of physicians and physical therapists and nursing staff able to answer all of the needs that come up when you're dealing with chronic pain.
I love just working closely with people, helping them out in any way I can, with a smile, with just making their appointments, easier.
I really enjoyed getting to know patients and really getting to help them and watch them get better because of what we've been able to help them with.
The Stanford Pain Management Center is not just a treatment center, but it's also a center that wants to further the research of pain management, the education of pain management, as well as the treatment of pain management.